Okay, let's dive into this. Welcome to this explainer, where we are going to completely rethink how we view severe menstrual pain. Because let's be honest, for far too long, society, and honestly often we ourselves, have treated intense period pain as this enemy to be battled. Or even worse, just a normal burden that we're supposed to quietly endure. But today, we are going to totally reframe that pain. What if it isn't just a localized nuisance? What if it's actually a vital, full-body messenger? We are going to unpack the science and the holistic signals behind endometriosis and chronic inflammation, and we're going to learn how to truly listen to what our bodies are broadcasting. So ask yourself this: is your period pain a warning sign from your body? I want you to really think about it. If you've ever found yourself curled up on the couch, totally unable to function, or wondering why your experience seems so much more agonizing than what your friends describe, I want to tell you that you are not alone and your experience is entirely valid. This is not about having a low pain tolerance. Absolutely not. It's about a specific biological alarm system going off inside you. And today, we're going to decode exactly what that alarm is trying to tell you. Here is our roadmap for today's explainer. First, we'll look beyond normal menstrual pain. 2, we'll uncover the hidden signs of endometriosis. 3, we'll explore the chronic inflammation connection. 4, we'll talk about seeking a hospital diagnosis. And finally, number 5, we'll get into Kampo and dietary balance. We have some really fascinating ground to cover, so let's get right into it. Starting off with Section 1, Beyond Normal Menstrual Pain. Now, what's really interesting about this slide is that endometriosis is a condition that is incredibly common, particularly for women in their 20s through their 40s, but it often masquerades as just a quote-unquote bad period. One of the most revealing indicators actually has nothing to do with a heavy flow. It's this specific number right here, maintaining a basal body temperature of 36.5 degrees Celsius or higher during menstruation. You see, normally, during a period, a woman's basal body temperature drops to around 36.2 to 36.4 degrees. But for those dealing with endometriosis, the body temperature often stays stubbornly high at 36.5 or above throughout the bleeding phase, and it only drops after the period completely ends. It's a really subtle yet incredibly powerful clue hiding right there in your daily temperature chart. Beyond just your temperature, there are some distinct medical indicators to look out for. When doctors run blood tests, they're often looking for elevated levels of a specific marker called CA125. Another major red flag, unfortunately, is difficulty conceiving. But perhaps the most prominent symptom, the one you literally can't ignore, is the sheer intensity of the pain. We are talking about severe pain that completely outpaces the actual amount of bleeding. The volume of the flow might be totally average, normal even, but the pain is just debilitating. And here is a shocking contrast that really isn't talked about nearly enough. We're talking menstrual pain versus ovulation pain. For some patients with endometriosis, the pain they experience during ovulation is actually far more severe than the pain they feel during their period. Crazy, right? It's so intense that there are women who don't even need pain medication during their actual period, but they literally have to rely on specialized painkillers just to get through ovulation mid-cycle. If your mid-cycle pain is bringing you to your knees, that is a massive red flag. All right, let's jump into Section 2, the hidden signs of endometriosis. When we think of uterine issues, we naturally just assume all the symptoms stay localized to the pelvic region, right? That makes sense. But endometriosis is characterized by ectopic tissue, meaning endometrial-like tissue literally grows outside of the uterus. And because this rogue tissue responds to your monthly hormonal cycle no matter where it decides to set up camp in your body, some women literally experience nosebleeds in tandem with their period. The tissue in the nasal cavity swells and bleeds exactly when the uterus does. I know, it sounds like absolute science fiction, but it is a very real, hidden symptom of this condition. And this brilliantly illustrates another hidden, deeply painful reality that revolves around something called the pouch of Douglas. Basically, this is a very tight, narrow space located right behind the uterus. And for whatever reason, ectopic tissue just loves to gather and accumulate in this tiny little pocket. Because the space is so restricted, when the tissue swells and bleeds, there's nowhere for it to go, so it causes intense, paralyzing spasms. Patients often describe it as a severe tingling or cramping pain that radiates right through the area. It is absolutely excruciating, and it's all about location, location, location. Which brings us to Section 3, the chronic inflammation connection. To truly wrap our heads around endometriosis, we kind of have to zoom out a bit. So the crucial point is understanding the definition of chronic inflammation. It's a prolonged systemic immune response where your body is constantly in a state of fighting off internal irritants. When we look at endometriosis through this specific lens, it completely ceases to be just a uterus problem. The ectopic tissue and the pelvic pain, they're actually just one localized manifestation of a much larger systemic issue. Your whole body is basically in a state of high alert. To prove this, let's connect the dots here. People dealing with endometriosis often suffer from seemingly random, totally unconnected issues. Things like unexplained toothaches, gum and dental inflammation, or how about mysterious lumps forming in the chest or armpit areas? I promise you, these aren't coincidences. These are inflammatory responses. Your body is sounding the exact same inflammatory alarm in your mouth and your chest as it is in your pelvis. It's all connected. This really requires a profound reframing for most of us. Endometriosis is not just an isolated condition. It is a clear sign that your body is dealing with systemic inflammation. Think of it this way. Your body is acting as a messenger. It is practically shouting at you that your internal environment is too hot, it's too inflamed, and it desperately needs soothing. If we just pop a pill to treat the localized pain, we are completely ignoring the root message. Okay, moving on to section 4, seeking a hospital diagnosis. As empowering as it is to understand these holistic alarms, you simply cannot guess your way through reproductive health. A proper hospital visit is absolutely critical because severe menstrual pain is a shared symptom for multiple overlapping uterine conditions. So yes, it could be endometriosis for sure, but it could also be uterine fibroids, ovarian cysts, or adenomyosis. And each of these requires a slightly different medical approach. You need a doctor to run the tests, check those CL15 levels we talked about, and give you a definitive map of what is actually happening inside you. No WebMD self-diagnosing here, please. Let's move to and see how this builds into our final section, section 5, Kampo and dietary balance. Once you have your diagnosis, you can actually begin to address that systemic inflammation using the ancient philosophies of Kampo, which is traditional Japanese herbal medicine. It's all about this really delicate yin and yang balance. To treat the systemic inflammation of endometriosis, Kampo utilizes a strategy called clear heat and detoxify. Basically, this suppresses the aggressive inflammation. But and this is vital, so pay attention. If you only clear heat, you run the risk of freezing the body's natural energy and causing extreme coldness, which, ironically, can also trigger pain. Therefore, Kampo carefully pairs these detoxifiers with warming supplements to protect your core temperature. It's a highly tailored, beautifully personalized balancing act. And the great news is, we can apply this exact same balancing act to our diets at home. We all know those heavily craved sweet foods, like chocolate and pastries, right? Well, they actually spark and feed systemic inflammation in the body. However, sour foods, think citrus fruits or vinegar, have a natural suppressing effect on the damage caused by sweets. In Eastern philosophy, sour flavors actually soothe the liver and counteract that inflammatory spike. Adding some sour elements to your diet can literally be a game changer for your inflammation levels. But let me stop you right there. I must warn you against extreme diets. Balance is absolutely everything here. If you hear that vinegar is good for inflammation and you decide to start chugging straight vinegar every day, you will actually backfire and do real damage to your liver. It's about flavor balance, not extreme consumption. Similarly, while citrus fruits are great for that sour kick, they still contain sugar. So the best approach is to enjoy your fruits in the morning rather than late at night, right before you go to sleep. So let's map out some straightforward, really empowering lifestyle steps you can take, starting today, to turn off that alarm of chronic inflammation. Step 1, don't overwork yourself and prioritize sleeping early. Honestly, exhaustion just breeds inflammation. Step 2, avoid overeating and specifically cut back on those sweets. Step 3, protect your body's core temperature by eating warm soups packed with healthy vegetables. And step 4, maintain flavor balance in your meals. Don't just eat sweet stuff. Purposely incorporate sour, bitter, and salty elements to keep your whole internal system in harmony. As we wrap up this explainer, I really want to leave you with one final provocative question. Is your body trying to tell you something right now? Take a second to check in with yourself. Whether it's debilitating pain, an unexplained high temperature during your period, or even something weird like bleeding gums, remember that your body is incredibly smart. It doesn't cause pain to punish you. It causes pain to communicate with you. Listen to those messengers, seek the right medical guidance, and take action toward holistic, systemic balance. Thank you so much for joining me today, and keep exploring the amazing science of you.